All right, Dennise, you're back with me today. You came from where?
Georgia.
Georgia. Okay. And you were diagnosed with?
Trigeminal neuralgia.
All right. So tell me about what your life has been like prior to and after having DTR done.
Prior to, it was basically pain all the time. It felt like when I would have severe flare-ups, I would have pain to the extent of having 5 or 6 teeth that were inflamed at the same time. And it would last for days. There was no relief whatsoever. My doctor started me on carbamazepine, started me half dose twice a day. So I started on that. He said increase the dosage after 2 weeks, and the flare-ups had gone away with the half dose, and so I thought I don't really need to increase that. So I didn't, and then I had major flare-up where I was down for a couple of days, and I thought, okay, well, yeah, I do need to increase that. So I'm on the medication. The medication made me just feel just completely stupid. I do accounting, so that was not good when you throw the check that you're supposed to mail in the file instead of mailing the check, or you mail the check without it being signed. It was just stupid stuff like that. Or sitting at a traffic light and go, does red mean green? Does red mean go or stop? That's kind of how it made my brain feel. And so I thought, I can't be like this the rest of my life. I don't want to be on this medication like this. And so once I came here, I was at the point where I kind of acclimated with the medication. I wasn't quite as dumb, and able to function a little more. But I always had that dull ache, like I was having a toothache.
Sure.
All the time. And I came here after the first treatment. You told me tomorrow you may wake up and you've bitten the inside of your mouth. And I thought, okay. And I did. I woke up the next morning, I had bites inside my mouth, and I thought, well, he told me that was going to happen. And I could immediately feel changes, like relief, like it just started, everything started to relax. And I told my husband at one point that I felt like if I could just get like a strong muscle relaxer that would just relax my face and nothing else, that I think that I'd be okay, but I don't think they have anything like that. So after the follow-up on that following Monday, you did some more work, and then you said you're probably you may have some soreness or some pain, and you may or may not have a couple of weeks where you feel some pain. I had some soreness in my jaw. I haven't had any pain whatsoever. I've been able to, I wasn't able to even sleep on my left side before, so I've been able to sleep on that side, and my brain had already trained me to, oh, you don't sleep on that side, you sleep on the right side. So when I would start to turn that way, it's like, oh, can't do that. Now, I wake up in the mornings and I'm sleeping on my left side. Or sometimes I'll just turn over on my left side, because that's the side I would normally sleep on. Turn over on my left side, like not even thinking about it anymore. It's not a thought. I can chew on that left side, and I remember the first time going, I'm chewing, I'm not thinking about it, and I'm like, all of a sudden I'm like, I'm chewing on my left side, and there's no pain. So it's been amazing. It's changed my life. It gave me my life back. I feel like it's giving me my life back.
Okay, well, you flew over a lot of dentists that probably could have done this exact procedure to get to me. And the interesting thing is, a lot of people will say, well, the technology is too expensive. or there's no value to me having this, what would you tell a doctor that thought that?
I would say you would save me a lot of money if I didn't have to fly over all these dentists that were not doing it. I cannot believe that something that makes so much sense and can change people's lives, that people just wouldn't even think about it. I think it's stupid. I mean,
Yeah.
I don't mean to call anybody stupid, but I mean, it's closed-minded.
Yeah.
If you are not even willing, if you were in this much pain and your options were to have a hole drilled in your head and pay $140,000 versus this, you would do it too. I mean, and you would do it for other people if you could. When I tell people, there's only 4 in the U.S. that do this, they're like, why? And I don't know why.
Yeah, I don't know either.
Makes no sense.
Well, hopefully we're going to open some eyes.
I hope so too.
Glad you had it done?
Oh, 100%. 100%. I'm on a support group online, and I see all these people that are talking about how much pain they're in, and I was actually advised not to do this, that you're probably, wasting your money, or this is, probably a scam, and I'm like, I'm rolling the dice on this, and I'm going to try it. And,
Sure.
And if it doesn't work, I'm not out $140,000, and I don't have a hole in my head. So,
Right.
I'm going to do this, and I wanted to go with the most non-invasive procedures that I could possibly find before I did anything else. And this was what I saw that made the most sense, and so this is what I chose, and I'm 100% glad I did.
Well, I'm glad you did. You were advised by whom not to do it? Another dentist, another neurologist, GP? Dentist.
Mm-hmm.
Yeah. I need to make sure that when this is all said and done,
Okay,
you
let's see.
don't say I told you so, but just go back and say, you know what, you might want to reconsider because this is my experience.
Yeah. Oh, I plan to.